My name is Paul Hill. I'm 72 years of age and I've come here to have my second cornea graft.
So Paul originally came to see me with a condition called Fuchs endothelial dystrophy. This is a genetic condition of the cornea. It's actually something we see relatively commonly, and it involves a loss or dysfunction of the inner corneal cells. And those cells are very important for pumping water out of the cornea.
And mine isn't getting rid of the water, so I'm having a blurred vision all the time. I can't see the detail. I couldn't see the edge of clouds, leaves. So I stopped driving. I didn't have to, but I didn't feel safe. And I haven't driven a car for over a year now. I hope to be able to drive again. And it's up to Masara to operate on my eye and put in a donor piece of tissue.
Corneal transplantation involves taking tissue from a donor. So that is a patient who has died and who has donated their eyes or their corneas for the benefit of other patients. And essentially we use eye banks, which are organisations designed to harvest and process that tissue in a way that is safe to use for donation. Unfortunately, since around 2020, there has been a shortage of corneal tissue in the UK, and that means that patients are waiting longer and longer for their surgeries, sometimes until their condition is more severe and their urgency level increases.
I started by going through the NHS and trying to get them to operate on me. I got to the top of the queue, but never any further than that, and it just went on, and after 6 months I thought, no, it's no good. I need it done as soon as I can. So we found OCL.
Paul came back to see me having been on the list for a year, and we decided at that point it was reasonable to proceed with treatment with us under private healthcare.
And it went on from there really.
We have an import licence with the Human Tissue Authority, and we're one of a few handful of centres that have the ability to import tissue for the USA. And the beauty of that is we're able to get tissue very quickly, usually within 48 hours. And that means we're able to offer our patients that rapid care that they really need.
And she's done it to my right eye. I can see 20/20 vision now, and she's now going to do it to my left eye.
Paul had a procedure called a DMEC corneal transplant, and we are placing a very thin layer of cells into the eye. It's actually thinner than a human hair, and the surgery is incredibly delicate. That tissue is very easily damaged, so we have to be very careful during the surgery.
I had my surgery last week, and it's gone very well. There's no pain at all. I would recommend coming here and having it done. Now I can look at anything, anywhere, and it's amazing. All these sort of things, all of a sudden you realise you can do again. Clouds, I can see the edge of clouds. I'm thinking of buying some binoculars because I'll be able to see through them, which I couldn't do before.
He's got a lot of hobbies and he's back into those activities. He's also going to resume driving more confidently, especially nighttime driving. So I think in the next few months we should see even more improvement, and I'm really pleased to see the improvement it's already having in Paul's quality of life.
It's amazing what you can see when you've got good eyesight.